Just in case you haven't heard, there have been two major COVID vaccine announcements in the past few days. On Friday, an FDA advisory group rejected COVID booster shots for all Americans. Instead, they say only those 65 and older or anyone at risk of serious disease needs a booster at this time.
And yesterday, Pfizer announced that their vaccine works in kids ages 5 to 11, and they'll be seeking FDA approval soon. And since then, we have gotten a lot of questions on both of these issues, so Megan Bragg verifies.
We've gotten several questions through our social media pages and our Verify email, both about the booster qualifications and the COVID vaccine for children. Let's start with the booster shot. Viewer Sandy Stewart writes, with the FDA's booster ruling, I have a question for those of us who are not elderly but are with lowered immune systems. I believe we're eligible for boosters. So who needs a booster? Our sources, physician Dr. Carla Robinson and the FDA advisory panel. Friday, the advisory panel voted to only distribute COVID booster shots to people ages 65 and up, as well as those at high risk of severe illness. Dr. Robinson says these boosters should only be given to two groups.
We recommend speaking with your healthcare provider regarding the appropriateness of a booster vaccine for you. You know, there may be some medical condition that you have that predisposes you to being a good candidate for the booster vaccine.
Now let's take a look at some questions from parents about the Pfizer vaccine for kids 5 to 11. On Monday, Pfizer said the vaccine works for children in that age group and will seek FDA approval soon. But many parents are wondering, is the dosage different for kids than it is for adults? Our sources, Dr. Carla Robinson and Pfizer. According to Pfizer, ages 5 to 11 will receive a 10 microgram dose level, which is about a third of a dose that adults are receiving.
The same medication, just a reduced dose, reduced volume. And that's something that for now the data has shown to be effective.
Finally, will kids experience the same symptoms as adults when they receive the COVID-19 vaccine? According to Pfizer, the study that involved children ages 5 to 11 was well tolerated with side effects generally comparable to those observed in participants 16 to 25 years of age.
You certainly have the possibility of local side effects like injection soreness or redness. And then certainly there's also the possibility of systemic reaction. And that's something that we saw quite prevalently with the adult population.
And those concerns do continue across Central Texas as frustrated parents, schools, and hospitals confront an increasing number of pediatric COVID cases.
Joining us now to get to the bottom of some of these concerns, McLean Children's Hospital Chief Medical Officer Dr. Dominic Lucia. Hello, doctor. Thank you for joining us here at 5 o'clock.
Thank you for having me.
Should parents have concerns about getting their kids 5 through 11 vaccinated after the announcement?
That's a fair question, Chris. I think that the short answer right now is no. It appears the data from Pfizer is very good, and when you look at the efficacy and the safety of the vaccine in both the teenage population and the adult population, we would expect it to be very similar. Now, there's going to be due process that needs to play out with the FDA approval. I've talked to some experts around McLean Children's Hospital. They suspect that's going to take around 2 months.
And with this recent wave of COVID cases, are the patients that you're seeing in the hospital trending any younger?
Absolutely. We have seen that with the Delta variant for sure, both in the pediatric population as well as the adult population. When you talk about the Delta variant in particular, not only is it more contagious, but it seems to be affecting younger adults as well. We've seen deaths in our region in 20 and 30-year-olds. And when you talk about the overall bed population of COVID patients just at the main adult hospital for Baylor Scott & White here in Temple, we're around 40 to 50% of patients under the age of 50, which is an amazing number and is much higher than last year.
I was going to say scary compared to what we did see a year ago, so noticeably different here in the Delta variant. Now, stories nationwide show that people are showing up to hospitals having had a heart attack, maybe they need an emergency, something done, and being turned away. Some are even dying, we're hearing, or suffering horrible consequences because there's just no room or they're waiting an extremely long time. What happens if I have a medical emergency? Am I going to get the care I need? This is a scary thought.
Yeah, it is a scary thought, and those are scary stories. I can assure you, we're not going to turn you away. You are going to get the care you need. We have creative alternative venues other than just the hospital and ED to help offload some of that heavy burden. We have amazing, hardworking teams that are going to continue to care for you the absolute best they can. But the reality is the pandemic has been a lot, and it takes up a lot of time and energy and space, but we're still going to give you the care you need. And one thing we want to remind the community is higher rates of vaccination in the community equals lower rates of hospitalization, and that's really what we need right now.
And so I guess I have to ask this question. Am I more at risk of dying now due to the hospitalizations than I would be if I had the very same issue, say 2 years ago before the pandemic?
That's a fair question. I wouldn't answer that without any data. I don't think that's the case at all. I think the hospital system across the state in our region has been burdened, but I think that people have stepped up. There's lots of extra work, lots of new designs to try to take care of patients in an efficient way. So I think you're still going to be safe coming to a hospital. If you have chest pain, if you have a medical emergency, come here. We need to take care of you.
Okay, real quick before we go, one more question here. You mentioned 20 and 30-year-olds now being hospitalized, something we didn't see a year ago. Are they vaccinated? Are young people dying who have been vaccinated? Can you clear that up for us?
Yeah, that's a fairly simple one, because really when you look at the folks that are hospitalized, the vast majority of those are unvaccinated, and that gets an even higher percentage when you look at those that are in the ICU and those that are requiring a breathing machine. The folks in our ICU, including the young folks in our ICU, 94% of those are unvaccinated. So the way to keep yourself safe, the way to keep your family safe, the way to keep your kids that are under the age where they can't get vaccinated safe is for everybody in the household that's eligible to get vaccinated.
And Dr. Lucia, how are you doing? How is your staff doing? How are those at the hospital who work there doing?
I am incredibly proud of our staff. They're hanging in there. It's not to say it's been an easy 18 months, but you see people leaning on each other, supporting each other, stepping up when the need arises. So they're hanging in there. I'm not going to say it's been easy, but we're hoping that with increased vaccination rates and people doing the right thing to take care of each other, there's a light at the end of this tunnel.
Yeah, well, your optimism and your want to serve and help the public is really something we can all be proud of. Thank you, Dr. Lucia, for everything you're doing for Central Texas. We do appreciate your time today.